I thank the member for McCullough. The question is that the amendments be agreed to, and I call the member for Lingiari.
Thank you, Mr Deputy Speaker, and I congratulate you on giving up that filthy habit 2 years ago, and as a result you're in fine fettle and will have a longer life. And for that we can all be grateful.
Thanks.
We'd like you to be here, son. And as other members have outlined the detail of this bill, I'm not going to do that myself, other than to say that we on this side of the House are supporting it. I do want to commend, however, the contribution made by the member for Macarthur in particular, a good friend and someone who comes from his background as a paediatrician, a doctor who's had a lot of experience dealing in health matters across the community. And he explained in a very detailed way the impacts on the health of individuals and of our community as a result of smoking. And as others have said, in 2011, tobacco use was estimated to be responsible for 9% of the total burden of disease. That's a significant figure. 80% of lung cancer burden and 75% of chronic obstructive pulmonary disease burden was attributable to tobacco use. Now, I don't think there'd be many people in this place who wouldn't know, either directly or indirectly, a person or persons who haven't suffered immense trauma and an early death as a result of tobacco. There'd be very few among us. And for that reason alone, the initiatives taken now so long ago for plain packaging against the protestations of industry, I remember them vividly. The remarkable attempts which were taken by industry to oppose the legislation championed by the then Minister for Health, Nicola Roxon. The case taken internationally to try and say that somehow or other this was illegal. Well, it wasn't, and it was the best thing we could have done. But the concern I have is that we've got to actually maintain our commitment to strategies to bring down tobacco rates, consumption rates. And I'm most particularly concerned about those people who have the most prevalent use of tobacco in the community, principally in this case Aboriginal and Torres Strait Islander smokers. And the comparisons are huge. In 2014-15, a national Aboriginal and Torres Strait Islander social survey found 39% of the combined Aboriginal and Torres Strait Islander population aged 15 and over were daily smokers, compared with 14% in the general population. The proportion of Aboriginal and Torres Strait Islander people daily smokers aged 15 years and over was 39%, compared to 45% in 2008 and 49% in 2002. So there has been a reduction, and that's significant, and it's very important that the efforts continue. In 2002, 51% of Aboriginal and Torres Strait Islander males aged 15 years and over were daily smokers. That daily smoking declined, that rate declined to 46% in 2008 and 41% in 2014-15. Now they're good things. And there's other data which demonstrates that tobacco consumption is falling in Aboriginal communities. But when you compare it with the broader population, the gap is not closing, because as we've seen, the consumption rates amongst the general population, the non-Aboriginal population, have also fallen dramatically. But the gap is not closed. And when I contemplated this, I remember well, Mr Deputy Speaker, the 2014-15 budget, you'll recall, Mr Deputy Speaker, that I was in a previous government the Minister for Aboriginal and Torres Strait Islander Health, and we initiated some measures around tobacco to prevention strategies and funded them directly to Aboriginal and Torres Strait Islander community health organisations and communities. And sadly, in their first budget coming into government, the Abbott government, Prime Minister Abbott, now the envoy for God knows what, and the Treasurer, Mr Hockey, brought down a budget which cut $500 million out of expenditure for Aboriginal and Torres Strait Islander Australians. $130 million of that was cut from the Tackling Indigenous Smoking program, which was publicly disparaged by the then Treasurer. Now understand this, Mr Deputy Speaker, just so we understand the nature of this and the prevalence of tobacco consumption amongst some populations. Indigenous Australians, Aboriginal and Torres Strait Islander Australians between the age of 15 and 27, male consumption is 34.4%, for non-Indigenous Australians it's 3.9%, for women it's 26.5% and 2.3%. That demonstrates the difficulty that we are having in bringing down tobacco consumption rates amongst Aboriginal and Torres Strait Islander people. And so think that a responsible government, or a government that purported itself to be responsible, with a Prime Minister now, and we were told at the time, the Prime Minister for Aboriginal and Torres Strait Islander Australians, this Prime Minister oversaw a budget which cut $500 million out of Aboriginal and Torres Strait Islander programs, $130 million of which went directly to the Tackling Indigenous Smoking programs. Now, I wonder, when the member for Winga gets on whatever he's getting on to travel around Australia as an envoy, and I don't know who he's going to be talking to, but do you reckon he might explain to them that he was responsible for oversighting a budget cut of $500 million, which impacted every aspect of the lives of Aboriginal and Torres Strait Islander Australians, that he might tell them that he was responsible himself for oversighting a cut of $130 million out of the Tackling Tobacco program. You can imagine what he will do, and it certainly won't be that. But having said that, despite the absurdities of the government, Aboriginal and Torres Strait Islander health services around this country have been working diligently to bring down tobacco consumption rates. Because as the member for Macarthur pointed out, the direct health impacts are obvious to all of us. And we have a responsibility to make sure that the funding is available for the continuation of these tackling anti-smoking programs. Now, I'm going to have to give up my position at this dispatch box, at least temporarily, in a very short space of time. But when I'm back here, hopefully tomorrow, or whenever else this debate is brought back on, you can all wait in anticipation.
Yeah.
As I can tell,
We're going nowhere.
you'll be here a while. Is I will talk about a couple of specific programs that have been introduced by Aboriginal communities or organisations around the country, which have had a dramatic and positive impact on reducing tobacco consumption in their communities. Mr Speaker, I think that brings around about now you're going to tell me to sit down.
You are spot on.